Okay, it looks like we're live. Good morning and welcome everybody to our second part of our series, our self-care series. We started this series last week, and we just want to say a big thank you to everybody who supported us and who continues to support us. And we hope you really enjoyed our talk last week. This week, we've got a bit of a treat for you. We have our clinical psychologist, Tanya Hemmings, interviewing or having a discussion with Dr. Margo de Kooker around mindfulness. And I'm really looking forward to hearing more about from the talk today, and I hope you are. I just want to remind you quickly a little bit about self-care and something we touched on last week. If you think of when you're flying in an airplane and they say in a time of emergency, the oxygen mask drops down. Hello, Mike. Lovely that you've joined us. Okay. When the oxygen mask drops down, they give you specific instructions to say, make sure that you put your oxygen mask on first before attempting to help others. And it's very important why they say that to you is because if you're not breathing, if you're not okay, it's very hard to help other people. And during this time with COVID-19, we find ourselves in a bit of an emergency crisis situation. So this self-care series is really just giving you an oxygen mask, trying to give you some tools, trying to assist with the space, just to clear your headspace and engage. And we're also just testing out this new platform for ourselves. Okay, so today we'll be talking on mindfulness, and I will be introducing Tanya Hemmings. And yeah, over to you, Tanya. Thank you.
Thanks so much, Jade. Thank you. So as a psychologist, I've used or introduced mindfulness to a lot of my clients because I've really found that it's helped them to get in touch with emotional states that they may be feeling and to help them cope with stress that is part of our normal everyday life. As I mentioned last week, I'm not a mindfulness teacher or trainer. There are specific people and trainers who do that in Port Elizabeth. And it is my great privilege this morning to be welcoming Dr. Margo de Kooker, who I've trained with previously in the past as well. Just to give you a brief idea of the structure that we're going to be doing today, I'm going to do a Q&A interview question style with Margo so that we can really focus in on what it's about. And you'll see as you're speaking to her, she embodies mindfulness. She's been doing it for a very long time. Then we are going to introduce you to a mindfulness practice so that you can practice at home with us and see what it's all about. And after that, we're going to be opening up to some of the questions. So we want to put aside at least 10 minutes. Hopefully there are some questions where you can just ask whatever you like to ask about mindfulness and to see how it would apply to you in your everyday life. And then the last 20 minutes, we're going to go over to Jade and Marelise to touch on their topics and remind you about why self-care is important in those areas as well. So let me introduce you, and I'm just going to do a short bio quickly. Actually, just bring Margo on. I've got somebody helping me today so that I don't look too distracted. Welcome, Margo.
Hi, Tanya.
Hi. Just a very brief before we're going to start asking her some questions. Margo de Kooker is a medical doctor specializing in wellness and lifestyle medicine. In her practice, Margo focuses on optimizing health and has a special interest in stress, nutrition, and healthy aging. Margo has received professional training in the clinical application of mindfulness-based stress reduction through the Center for Mindfulness at the University of Massachusetts Medical Center in America. Over the last 20 years, she has presented a wide range of programs and workshops in stress management, resilience, mindfulness, optimum performance, and nutrition in the corporate as well as the public sector. She has also presented many CPD accredited workshops for health professionals in psychoneuroimmunology, let me say that again, it's quite a long word, psychoneuroimmunology and mindfulness-based interventions. So welcome, Margo.
Thanks, Tanya.
Right, nice that you're here. I think let me just over to the first question, because then you can really speak about a topic that and a practice that is very close to your heart. How would you describe mindfulness?
I think we have so many different ways in which we can think of mindfulness, and some people would see it as a tool or a strategy. So there's many ways to consider it, but I'd like to think of it as an orientation, as a way that I can approach something. So obviously, if I learn to approach something from a particular perspective using certain abilities that I naturally have, then eventually it becomes somewhat of a skill. So mindfulness becomes something like riding a bicycle. You build a certain skill with it, but it is built from capacities that all of us have, which is the capacity to pay attention and to observe and to notice what is happening within us and around us.
I like how you've described that. So it's really, we use ourselves as the tool to orientate ourselves how to work with mindfulness. There's no special set of skills that we have to learn. It's something that we already possess, that we actually can just become better at as we practice it.
Yeah, and also I think learn to focus our capacity for mindfulness in a very intentional way, so that we can move through certain situations, particularly stress, in a more skillful manner. And in doing so, I think the value of mindfulness is that it allows us to give ourselves more options than we might have thought we had in the beginning. So in that way, it simply is one of the most amazing tools for self-management, and definitely managing ourselves in the face of challenges and stresses.
Yes. I see you spoke there about intentional way. So I'd like to bring a little bit of more focus in on that, because I know that's one of the central tenets and the central practices of mindfulness. What would you describe as the core components at the heart of mindfulness?
Well, one of the more official or very much agreed upon ways of looking at mindfulness is talks about paying attention on purpose, without judgment, moment to moment. So mindfulness is not it's an ongoing process, and that whole idea of paying attention on purpose, rather than having selective attention, which we often do have. We pay attention to things that maybe are very dominant, or figure a lot, have a lot of energy, and come into our awareness with a lot of force. And often we have a kind of selective attention, and then we continue only seeing what we're looking at. So, us human beings have got incredible capacities. One is the capacity to focus. And if I only focus in a corner, and one corner of the room, and I'm only looking at one corner in the room, I'll only see what's in that corner. Similarly, if I only focus on one way of being, one way of feeling, thinking, seeing, I could fall into the mistaken assumption that is all that I am, or that is all that is within me, or that it is all that I'm capable of. So mindfulness encourages us to look with a certain degree of curiosity, and a kind of in a very childlike, curious way, to look at what else is there, in terms of the situation, what's happening within us, so that we can get a better grasp of any moment that we find ourselves in, and then handle the moment in a more useful way. Then we might actually have more information to work with, and in that sense, we might have a different response to the moment.
Absolutely. I think what I wanted to bring in at this point, because you're talking about curiosity, and how in our habitual lives, when we're under perhaps a lot of stress, anxiety, tension, and we're even looking into how we're experiencing this pandemic, we tend to close down instead of opening up, as you are exploring now and talking about a curiosity mindset. Could you perhaps comment on why, in particular, a lot of professionals, if you tune into a lot of these talks at the moment, from various professionals across the board, they are actually bringing in mindfulness, and they're actually mentioning that to people. Could you explore that a little bit with us as to how it could be helpful for us right now, particularly?
Sure. I think, I mean, we're in a situation that is really quite unique with a lot of uncertainty. We certainly are being bombarded on the one hand with too much information, but we're uncertain as to the accuracy or the whether we can trust that information. So it's leaving people in a very uncomfortable state, and even professionals, we're learning as we go along. And human beings naturally find uncertainty quite stressful. And so wherever our level of responsibility or response to the SARS-CoV-2 and the COVID pandemic, wherever we make our contribution, we have to be able to tolerate a lot of uncertainty and to bring mindfulness into that. It helps us in one way to register that we are feeling uncomfortable and to deal with that in a timely manner. So not wait until discomfort builds up to the point where I overreact to things. So mindfulness gives us an opportunity to tune into ourselves and just gain a bit more insight as to how we're reacting and responding. So feeling ourselves out. It gives us an opportunity to stop and also apply some discernment and some inquiry into all the information that is bombarding us, how accurate this might be, and whether we're getting too caught up into the social media drama, whether we're fueling it, whether we're getting caught up in a WhatsApp stream or a Facebook stream of information where we find an hour passes in our day and we've just been sitting in front of a social media platform and been going through some automatic motion. So I think mindfulness gives us an opportunity to stop for a moment, reflect, inquire. And certainly we say in mindfulness, we talk about some of the foundations of mindfulness, and one of them is the beginner's mind. And the beginner's mind is looking at something as if it was for the first time. And strangely enough, with this pandemic, we are having to look at things as if it was for the first time because we don't know a lot. But on the other hand, we might find ourselves slipping back into what we thought we could rely on, or what we've sensed we could rely on in the past. And perhaps we need to just always step back and re-look at a situation. Or we say, oh well, they've this is done and dusted, this information, now we know this. And that can be quite dangerous in this kind of context where we always want to come back and say, let's just look at it afresh. And the other area where mindfulness can be very useful is that if someone has been in lockdown and their routine has been literally shrunken down into the very basics, they haven't been able to do a lot of the things that they're able to do. It then becomes approaching everyday life with the beginner's mind. So where we used to do many things automatically or took things for granted, I think being mindful, which is paying attention to the things we do on a day-to-day basis and actually exploring the fact that they might be quite enriching. So people have been certainly baking more than they've ever baked before and finding new joy in the kitchen after they got over the horror of having to be in the kitchen every single day. And finding new inspiration in their gardens, realizing how much they miss nature. So in a sense, we've been thrust into the beginner's mind where we've been looking at things that have been kind of everyday occurrences with a new sense of appreciation, which is not a bad thing.
Thank you for that take on it. I like that how you've brought it back to the fact that actually we are being forced to, whether we like it or not, to explore different ways of coping with our feelings, with our thoughts. And something like mindfulness can really help us to intentionally go into those spaces. I think I just want to explore a little bit in terms of the uncomfortable feelings that you were bringing up, that people are. I mean, we've seen that all over social media, none of us are prepared for this. None of us have really the answers, and we're all groping, trying to figure out the best way to deal with it. So if we have these uncomfortable feelings that you're speaking about, and that we know are probably stressful reactions or anxiety, uncertainty, even depression, how would using mindfulness, wouldn't those uncomfortable feelings maybe get worse? Wanting to figure out how we would address that using mindfulness.
Sure. I think one thing we should really consider is that human beings have got this stress response, which is a very healthy response, and stress response is considered to be what we would say a normal response to an abnormal situation, and we certainly are in an abnormal situation. So one of the things that I think is quite important is that we not judge ourselves for feeling stressed and for feeling somewhat out of control and for feeling that there's so much uncertainty, that we're having emotions around many things that we never used to have to worry about. So it isn't a very stressful situation, and it's appropriate to stress. What we say is that we can apply mindfulness to come back to moments when there's no apparent stress in that moment. So much of the stress that we generate can be really linked to where our heads are going, where our minds are going. So I'm thinking of a possible scenario, a worst case scenario, or worrying about a loved one, or worrying about an aspect of my life, and I suddenly find myself in that world with inner dialogue, pictures in my head, and literally my whole body and mind are transported into that other world, literally a world that I've created in my mind, and my body and stress response are related to that. And it's something that will happen when we're in such unusual circumstances, and our challenge is to notice that we're dwelling, or perhaps over focusing on a certain way of being, thoughts, emotions, and to take a moment to step back. And the stepping back is noticing how I'm feeling, taking a breath, noticing where I actually am as opposed to where my mind was taking me, and reconnecting with where I am. And maybe where I am is actually standing, outside or inside, and there's the window, and there's greenery and sunshine, and literally reconnecting with that, noticing, okay, so there are some things that are still okay, still normal. And in that way, the stress response will naturally dissipate, because I brought myself back into a moment where there's no actual stress in that moment. We all will probably find ourselves in a position where we're worrying about someone that we care for very deeply, and that's again going to cause a lot of stress. And it's to acknowledge that stress and be gentle with ourselves, not to judge ourselves for stressing or having certain emotions, realizing that that's what being a human being is about, but also giving ourselves the permission to step back. Literally, people would use the phrase, come back to your senses. Tasting the food, smelling the fragrances around you, taking a walk in the garden, feeling the sunshine on your face, digging in the garden, listening to the laughter of children who are playing around in the neighborhood, still appreciating beauty. And so mindfulness reconnects us with what is still right and in a sense normal, in inverted commas, where our tendency when we're under a stress response is to, because stress is a survival instinct, we keep our eye on the things that are not normal, that are threatening, and we simply need to balance it. There is no one who should sort of in this circumstance be saying, well, I'm not stressing at all. We all have some degree of stress and the uncertainty, etc., because it's a very novel situation.
I like that a lot. You're really bringing us back to the fact that we can tend to catastrophize certain thoughts, emotions, memories, sensations, and not to say that we shouldn't. So you bringing us back to the fact that that is part of the human condition, but how to really link in with those moments that are actually profound, that will lift us up, that will provide some ease and comfort. I think that's lovely.
And I think even in the most challenging of times, there are moments when there is no immediate threat. There are moments of beauty, there are moments of laughter, there are moments of joy, and we need to capture those moments and actually savor them and taste them and feel them. Otherwise, the balance really goes out, in the sense that everything feels like the stress is all consuming. Everything feels like you're in emergency mode all the time. And it's something that people on the front line also are struggling with, because there's just a level of intensity that we've not experienced, and to just take those little mini breaks, little gaps to decompress. Very, very important.
Yeah. So even at the height of it, when we get into the height of the pandemic in about August, whenever it's going to happen, September. So just to remind ourselves to, even then, even when it feels like we're frantic, to find those moments of peace, joy, connectedness, to practice self-care.
Correct. And really using our senses, because we know that when we're really tasting or smelling or seeing something, looking at something with intention, we're actually are in that moment. So literally capturing those moments and remaining in them. Often we often get a compliment from another person, and we kind of brush it off. But a critical statement, or even just someone giving us a look, we cling to it for the rest of the day. It kind of clouds our experience, and so we're even more challenged now to spend a little bit of time soaking up the pleasant, and not necessarily pleasant, but just the things that reconnect us to what we value in our lives.
I think what would be nice is one of my questions I was going to get into really asking you about anxiety, and there was a question that came up just now that I think links directly into that. If we could try and bring that in. Navi Moodley says, "Hi Margo, what is the best way to practice mindfulness for people diagnosed with severe anxiety, especially in highly stressful situations?" Could you perhaps comment on that?
Sure. I think that's the challenge, is that when we're in a highly stressful situation, it's actually appropriate to be stressing. But when we're out of the immediate danger, and that's where we have to keep our eyes open, because often the immediate high stress situation has already passed, but we're still living in it in our heads. So if it's a stressful situation, you're supposed to stress, because that's your survival mechanism. The stress response gives you the energy to get out of the stressful situation. And I'm talking about a really physical stressful situation, or a disaster, or the acute phase, in a sense. Once that's over, then it's the time to perhaps take a moment, take a few breaths, reorientate to, where am I right now? How is my body feeling? Am I still under threat or danger? Knowing that I now have many other and new and stressful thoughts in my head, but where am I right now? So something that is quite important is that mindfulness is not meant to suddenly take you from a highly stressful situation where everything is going crazy to peace and calm. That's not the point. Mindfulness is a way of navigating reality, and sometimes reality is that things are extremely stressful, extremely out of control. And then how we bring mindfulness into that is that we feel how stressed we are, and we notice how we're out of control, and we do what we need to do to get back in control without harming ourselves and without harming other people. So there, you can rush mindfully. You can be stressed and in an emergency state mindfully, in that I know I'm here, I'm not on autopilot, I'm not unconscious to how I'm behaving. And in that way, I think mindfulness helps us get through an experience in such a way that it doesn't harm us unnecessarily, and it doesn't harm other people unnecessarily. The most important thing when I'm extremely stressed or anxious is to notice it, as opposed to try and escape it or try and relieve that stress or anxiety in a way that might be harmful to myself or to another person. So noticing and seeking help if there are really extreme situations. So I really think that we need to have our people who we can talk to, our strategies in place for emergencies, because we really don't know what is coming. And people who are very anxious need their support systems and their mental health support in place, because it's a very anxiety provoking situation. So I would never expect someone to go from a high level of anxiety and stress down to, okay, I feel absolutely peaceful and calm, because it's often very unrealistic. So I think mindfulness becomes an easier to use skill as I practice it more in just day-to-day situations, as opposed to thinking, well, I'm going to quickly pull mindfulness out of the box and I'm going to feel better. That takes some practice, and even with lots of practice, we lose it. So one thing we should be is to be kind to ourselves, and to realize that we're all in some way under a new level of stress and uncertainty.
Thank you. I think that also tied in with Philippa's question just now about, making sure that we don't then project that stress onto our children, because if we aren't in control of ourselves, if we're not being aware, as you're suggesting, Margot, we should be aware of what we're feeling and mindfully stressing, not like having a complete freak out, but mindfully doing it in ways that are not harming ourselves or other people. We then are going to be protecting our children as well from.
Correct. And yeah, absolutely. And I think there's some experiences where we do have reactions, and it's to not overreact, but also to, if we do have untoward reactions, to reflect and discuss and possibly unpack in a very honest way about, maybe I did overreact. So I think we'll see a lot more of our tendencies to kind of be on the edge emotionally, and to possibly overreact or be kind of wound up a little too tightly. And it's just to realize, okay, here I went again, I kind of lost it. Let's just all sort of be honest about it and move along from there. So mindfulness is it's something I apply to myself, as to, I keep track of myself before I get too caught up in things. Mindfulness of what is happening around me. And I think another aspect of mindfulness at this time is just, we talk about mindful consumption, and to really discern the kind of media streams that you're going to be consuming, the news that you're consuming. Are you going to just consume everything indiscriminately? Are you going to overconsume in terms of news and media and information? How are you going to integrate that? Obviously, we could also look at consumption in terms of, just looking after ourselves on a day-to-day basis. What am I eating? So the more our diets might spiral out of control, our mental resilience might spiral out of control with that. So, being much more mindful in terms of how we're eating, and being mindful of all our crazy tendencies that we might have. You find yourself at 2:00 in the morning watching movies, or kind of gaming until 4 in the morning because you don't have to go to work. So many people are finding that many routines are potentially being disrupted. And so our mindfulness comes to just, how am I doing my day to day? And what am I trying to escape from? What am I avoiding? What am I over consuming?
Mhm.
And it can be a very interesting informal practice of taking stock
Thank you.
on a regular basis.
So we can make it a practice. We can have our daily mindfulness practice, maybe where we're breathing and doing some of the mindfulness practices which you might be able to share with us shortly. And then also the mindful moments that you're talking about, just bringing it in throughout the day, how we're thinking, being aware of our feelings, being aware of then better responding instead of being reactive. Margo,
Correct.
I'm
I think
aware, yeah?
I think just informally bringing attention to where we are and adjusting things if we feel we need to.
Right. Margo, I don't want to run out of time before we've introduced a practice. So we've got a
Sure.
very treat that Margo is going to be introducing us to a breathing space practice. And then after that, we'll deal with any other questions that have come up before going over to Marelise and Jade for the last probably 15 minutes. So,
Great.
Margo, over to you. I'm going to bring myself out of the stream just so people can concentrate fully on you because you embody it. Thank you so much.
Thanks, Tanya. So the breathing space practice is something that comes from an approach called mindfulness-based cognitive therapy, and Mark Williams developed this practice. And it's a way of creating literally some breathing space for yourself. So I'd like you to think of a feather, and very few people are afraid of a feather. So it wouldn't stress you out if there was a feather lying on the floor in the room that you were finding yourself in, or on the lawn. But if someone took that feather and put it under your nose and irritated you with it by tickling your nose, you'd find that feather almost unbearable to tolerate. And so we find that what stress does is it causes what we call hyperfocus. All of our focus goes into the experience of stress or the stress itself, and we have no space for anything else. So we hear people when they're under a lot of stress, they say, I just need some breathing space. And so this exercise talks to and speaks to that idea of breathing space. So what I'd like you to do as we go through this exercise, which won't take much more than a few minutes, is to perhaps bring to mind a situation that is troubling you, that's causing you some stress. And I'm going to take you through the practice. You can close your eyes and join me through this practice. And so bringing to mind a situation that causes you some stress, that you're grappling with, that maybe it comes into your thoughts and causes some physical stress and tension. So bring to mind something that you might be struggling with. And our first step in working with this is simply noticing. When I think of this situation, what happens in my body? Am I able to notice any tension, any unusual feelings? Am I able to become aware of any emotions or deeper feelings or thoughts around the situation? So tuning in for a moment and noticing any thoughts, feelings, what kind of inner dialogue comes to your awareness when you consider the stressful situation. So we start by checking in with our bodies, our minds, our emotions. And we look at what is there with a very impartial gaze. We're just noticing. So inviting you to simply pay attention to how this situation impacts and what you're able to become aware of, and allowing all of that to be there. So we're not trying to change it or do anything with it. And with it being there, realizing that we can shift our attention to any place we choose. And I'd like to invite you to bring your attention to your breath. So we're all breathing without even having to think about it. So allowing your attention now to simply follow your breath in and out of your body. So noticing your breath entering your nostrils and moving down the back of the throat, expanding and pushing into the lungs, moving the rib cage and even your shoulders, moving a little with each breath, noticing that your tummy might push out and fall back with each breath. And regardless of any thoughts, feelings, sensations that come into your awareness, simply allowing them to be there, but noticing the breath. And it's like your attention is riding that wave of breath into your body, and even just resting on the breath and following the breath in and out. Noticing what breathing feels like for you. And then with each breath, allowing each breath as it comes into your body to help you to expand your sense of awareness. So with each breath, imagining that you're pushing your awareness to extend even further to the left and to the right, to the front and to the back, above and below your body. Almost expanding your sense of awareness. It's like if you were thinking about your hearing, you're trying to hear the sound that's the furthest away. So each breath allowing you to expand a sense of awareness to the front, to the back, to the left, to the right, above and below. Each breath getting a sense of this expansion, allowing that sense of expansiveness to develop and increase with each breath in and out. So with each breath in, expanding. Again, not trying to shut any thoughts or feelings down, but simply pushing the awareness outward. Maintaining an awareness of the breath. And getting a sense of that expansiveness. Allowing your awareness to really go as far as you can imagine. And that idea of trying to listen for the sound that is the furthest away. And the breath flowing very comfortably in and out. And what I'd like to invite you to do is, from this perspective, bringing that very challenging or stressful situation to mind again. And noticing what it feels like from this perspective. Noticing its gravity or its the way that it shows up now that you're observing it from somewhat of a different sense within yourself. So taking a moment to get a feel of that. And then reconnecting with your breath and perhaps taking a nice deeper breath in. Exhaling comfortably, feeling your feet on the ground. If you're sitting on a chair, your bottom on the seat, noticing your hands where they may be in your lap. Perhaps you're lying on the floor listening to this, feeling your body where it's making contact with any other surface. And opening your eyes when you're ready, and just noticing how you feel, noticing how your body feels, noticing how your mind feels. So that's the breathing space. You've given yourself a little bit of breathing space. It's a wonderful practice. You can pop onto the internet and download a little guided breathing space. If you Google it, it's a lovely short practice just to create a little bit of headspace to manage some of the stresses and strains that can take our focus off everything else that's there.
Thank you so much, Margo. I feel, wow, really that I was able to benefit from that. And I hope that everybody else listening in and who listens in afterwards can actually certainly benefit from this. Thank you for doing that.
My pleasure, thanks.
I think that sense of spaciousness and the fact that this situation that was stressing me out previously can actually be held with more kind of compassion, and I could accept it. I was aware of accepting the situation.
Yeah, I think that's fantastic, and perhaps things look very different when we've got a little bit of we can step back from them. And so what we were doing was essentially stepping back a bit and giving ourselves a little different view. So we always have that capacity to just take that step back and create a bit more space so other things can float up. But thanks for the opportunity to share that.
Thank you. So we've got a few more minutes before I call on Jade and Marelise. I just want to see, are there any questions that we might have missed that would be amazing for Margaret to address?
Philip mentioned this.
Philip has mentioned being in the moment and connecting with your breath. Listen to Eckhart Tolle. I know I've loved Eckhart Tolle as well.
Sure. There are so many fantastic teachers, and mindfulness has exploded into every corner of our lives, and it is essentially a mainstream concept nowadays. In the sort of early middle 90s, when mindfulness first sort of came to a lot of our awareness, and articles and books were coming out, it was considered fringe, and now it's something that we bring into, it's in the corporate setting, it's in every setting, and it's been fantastic to see how it's developed. So there are some awesome authors. You'd be hard pressed to choose, because we've got incredible mindfulness teachers and practitioners.
Thank you, Margaret. That's lovely. Thanks, Kim, my homie. So I think I'd like to focus on a question that might be quite applicable to a lot of people, if not at the moment, perhaps coming up.
Sure.
In this pandemic, if a loved one is in hospital and no visitations are allowed, how can mindfulness help me address the feelings of uncertainty and fear that one feels, especially if the loved one is very sick? What would I know you've shared a lot with us already, but just a little bit of this is something that people can probably be aware of in the next short while.
Yeah, and I think there are many unknowns, and none of us know whether we will be in that kind of situation in the future. And we have these unusual situations where people can't be with their loved ones. So it's going to challenge us in many ways, and I think there's going to be a lot of emotion around that, and we need to acknowledge that, and perhaps think of ways in which in again that very traumatic kind of situation, where we can touch on the things in our lives that are still whole and sustain us. I think we might look at things like journaling or writing to the person, so that I can at least get those feelings out of my body and I can express them. Perhaps it is a good time for us to make sure that the people that we care for know that we care for them, and that we are concerned about them. In those very trying times, we need to have our support systems, our support strategies, and mostly I think we need to be very kind to ourselves. We are going to have very stressful situations and some unknowns to face. So I have a colleague who says, humankind, be both. And I think that's exactly what we need to do, to be human and to be kind, particularly to ourselves, and seek out support, take care of ourselves, take care early in the process rather than wait for emergencies to happen, and seek support with our circles of friends and family. But we are going to face, I think, some additional stresses and challenges and great unknowns, and hopefully we can face that with an open mind and with a balanced approach to the difficult and the beautiful at the same time.
I love how you've drawn it back to that and practicing. So if we can practice some of the things that you've shared with us today, we will build that container for ourselves of self-compassion, self-care. I certainly experienced some of that in just what you shared with us today. So not to leave it right up until the brink when we are dealing with that critical situation. And also to remember that to reach out to our normal sources of support, and particularly if you need help from friends, from psychologists, from medical doctors, from psychiatrists, from whoever you are able to reach out, because that is in itself a sense of self-care. Yeah.
And I think very much want to echo what you've just said is don't be scared to reach out, and the difficulties that we might be feeling and experiencing, not to judge ourselves, but to move towards getting the support that we need.
Great. Thank you very much, Margo.
Thanks, Tanya.
I think, would you be, when I bring Jade on shortly, we're going to bring Jade on next, will you be able to remain backstage for a few minutes? We're ending off at 12:30, just in case somebody has a particular question that they might still address. Thank you. Oh, before I do that, I do hope that you're going to be doing some mindfulness courses online at some point, because we don't know how long we've got under this current, lockdown and social distancing scenario.
Indeed.
Are you considering doing that?
Certainly. So I think it's a case of watch this space. We'll see how things go. But yeah,
wonderful.
It's always wonderful to teach and to share mindfulness. So yeah.
And normally those teaching courses would be over 8 weeks, if I'm right?
Yeah, we like to look at about an 8-week program. That seems to be quite a comfortable 6 to 8 weeks, and very practical for living mindfully, and managing the day-to-day ups and downs. So yeah.
Watch the space, everybody. Okay.
Thanks,
thank you so much, Margo. Thank you.
Go well. Take care.
Okay.
Bye.
Okay, we're going to be bringing Jade on now. Jade, remember to unmute your mic. I saw a message just now from Neil Zietsman saying that there's an app called Insight Timer. So there are a lot of apps. As Margo said, there's a lot of different sources out there, beautiful sources that you can read up on. There's also a lot of mindfulness apps. So here's one that has been suggested, Insight Timer from Neil Zietsman. And I'm personally using one called Unwinding Anxiety, which I'm also finding very useful. So find one that meets your needs and watch the space for Margo for those courses. Thanks. Great. So Jade, remember to unmute your mic. Great.
Hello.
Jade. I hope you also were able to benefit from that beautiful breathing space practice.
Definitely. Thank you so much for arranging that, Tanya. It's really a treat and honor to have Margo here joining us.
Absolutely. Absolutely.
Yes.
So what have you got to share with us today? Give us a little heads up about next week, because you're going to be handling most of next week's self-care session.
Yes. So next week we will be looking at relationships. And today we looked at mindfulness and just considering our headspace. Next week we'll be looking at our relational spaces and how to look after ourselves, how to care for ourselves in terms of our relational space and our relationships. Just thinking about, off the top of my head, creating safety in relationships. What makes us feel unsafe relationally and what makes us feel safer? If I think of conflict and what is conflict? Conflict is us wanting more, wanting better, wanting more quality connections. Um, so really just looking at what's underneath conflict. How do we facilitate better and more quality connection with our loved ones? That could be with children, with parents, with spouses, lovers, friendships even. All relationships are so important. I don't know if you want to say anything on that or
Well, I just think I think it's an important dimension. So we're now going forward off this base of looking at our lives and how we are dealing with our situations and ourselves mindfully, and how are we going to then, in our interconnections, how are we going to bring that about? So I think it's beautiful that you're going to be exploring that with us. I've personally had a lot of clients lately asking, how do I just stop, getting mad at my kids? And so I'm glad that you are going to be looking a little bit into that, because, yeah, we're all facing tense times and we're not always going to be mindful in the moment. Be kind, find ways of being kind and bringing self-care to ourselves and our loved ones, which is why we really spearheaded this series. So I'm really looking forward to that.
Definitely. And I'm just thinking, we have to be more aware. So mindfulness creates awareness. And my talk is kind of looking to create awareness around ourselves in terms of relational space and what triggers us to scream and shout and lose control in a sense. And how can we just pull that control back again? How can we spend our energy a little bit better? Because I can imagine sometimes relational conflict drains a lot of energy. So yeah, I was also just thinking, I attended a talk yesterday evening with some lovely Imago community members. And something I heard there really, really lovely is just, and it's so fitting with the mindfulness talk today, is mindfully connecting to a sweet moment. If you find yourself really battling, just to close your eyes, do some breathing, and really just ground yourself and think of a sweet moment you've had with a loved one. And it can really bring a lot of joy and a lot of comfort in a moment where there's difficulty. And some sweetness, to sometimes where situations can seem a little bit bitter or sour or difficult, just to allow ourselves to reconnect with sweet moments that are past, but that can still have a lot of power in the present moment as well.
Thank you. I think that also connects in with Margo, with what Margo mentioned earlier about when we kind of become really tense and we focus in and we close down, we don't remember all those sweet moments. We kind of forget about them, or it's not even in our awareness. But the more we practice and the more we nurture ourselves, our relationships, we will become more aware of those sweet. I like that description, the sweet moments.
Yeah, lovely.
Lovely.
Okay.
We've now got 5 minutes left. I don't think there was a question. There was a comment from Dawn Taylor. Thank you for this. She says it will help her and her daughter with her autistic grandson's scary meltdowns. So, yes, that could be a whole topic in itself, Dawn. We're not going to focus too much on now, other than to say, well done for recognizing that this can assist you. But as Margo mentioned, to also just keep on reaching out for those other support bases, because I can imagine that must bring a whole different ballpark of challenges. And look after yourselves and be kind to each other. And maybe if you become aware of your emotions too, maybe that might bring a little bit more space around the whole situation, and maybe that might assist with what's going on. So, but remember your other support bases, reach out for them. So thank you. We've got a few minutes left. Thank you, Jade. We're going to bring Marelise on. Unmute your mic, please, Marelise.
There we go.
There we go.
Good morning, everybody. It's nice to be back, and thank you, Margo and Tanya. I'm going to be talking a bit about trauma in my section when it comes up, and grieving the loss of normal. And in the readings that I've been doing, suicide has been coming up more and more. And Margo mentioned it so beautifully when she said that trauma is normal emotions to abnormal experiences. And I've got a question for both you and Margo this morning with regard to the concern around suicide is if I start feeling suicidal, with thoughts starting to come up, how can mindfulness help me in sort of just recalibrating again?
Okay, we're going to bring Margo online. Margo, are you there?
I'm here. Can you hear me?
Yes, we can hear you. So the
Great.
question was how to recalibrate ourselves in those crisis moments.
Yeah, I think it's a great challenge because parts of us, and I think this is often something to consider, is that in many instances, many people, a part of them feels like there's really no hope. So there is some real despair and a sense of loss of many things that we take for granted. And I often say that sometimes a part of someone really sees no light at the end of the tunnel. And what we want to sometimes do, and the recalibration is often not so much, I would say it's more coming back to a perspective where all the parts of me can be heard. Where a part of me might say, this is hopeless. If I focus and strongly identify with that sense, it'll feel like everything is hopeless. It'll feel like I'm hopeless, everything's hopeless. But if I acknowledge that a part of me feels like it's hopeless and even makes a bold statement like I might as well end this, just to acknowledge that and again, very, very compassionately hold that part of me that is so despondent and do nothing except notice it. Often what comes is another part that answers from within me. And so many parts of us have got very conflicting takes on this. And I think it's often something we neglect to do, which is allow the different aspects of ourselves to speak and to give their voice and opinion on the situation. And one part will say it's going to be okay, and another part will say it's not. And another part will say, who cares? Another part will say, run for the hills. and another part will say, who's to blame, and I'm going to get that person, and why is it like this? And so to allow for space for all of those mixed feelings, and to constantly, rather than get caught up in what a part of me is putting out there, to see that part as almost, we talk about the people inside of you. Take care of the people inside of you, and listen to what they have to say, but you don't have to do what they suggest. So we all have these very different, very complex mental lives, and we have literally different people inside of us that have different opinions. So our self-complexity can often come into play when we have very, very strong emotions, like what's the point, is to actually acknowledge that a part of me feels like this, and it's not an invalid question, but allow other parts of me to speak and to also give their opinion. And there might be a part that says it's going to be okay, and then you sit with those two parts. Now I can choose between two, and maybe another part will say, but this is not the be all and end all of everything, and we can still do something. And another part will say, I'm gonna make a difference. And another part will say, yes, I'm still okay. And another part will say, I'm not okay. And so our self-complexity is very, very important in this context, because I think parts of us are going to be hit hard, but there'll be other parts of us that are much stronger and can hold us together, while those other parts are under a huge amount of stress and strain. So remember, there's as much as we like people to have a sense of this, you are an integrated whole being, but you are also very complex on a mental level, and you have many different thoughts and aspects of yourself. And so listen to them, because sometimes that one self aspect that you've never really given any airtime will come up with a solution that's really useful. And most of us have got a part of us that can look from a different angle, that is often very kind of hopeful, or even childlike, or even just has a sense of humor that carries us through very, very difficult situations. So don't neglect those parts of yourselves, for us, for all of us, take care of those quirky parts of us. They might be the only ones that are left standing in some very stressful situations.
I
Yeah.
love that response. Sorry, Marelise, what would you like to say?
Thank you, Tanya. Thank you, Margo. That's very true. It's remembering all those parts and maybe having to pull on them sometimes and say, let's just come and have a bit of a conversation here and talk about this.
Correct.
Thank you very much.
Thank you. So just to end off with, thank you. I think that answered beautifully what mindfulness can do in terms of bringing in flexibility and creativity, and not fixating on only the parts that seem to be screaming the loudest and saying there's no hope. There are other parts of us too. So thank you. Thank you, Marelise. Thank you, Jade. Thank you, Margo. What an honor to have Margo here with us today. And we are now on 12:30. Thank you to all of you who've looked at us online, and you're going to look at us afterwards. And I'm hoping you're going to pick up some useful skills here, and useful ideas, and new ways to hold yourselves in compassion, and to practice self-care. And next week we welcome Jade to be speaking about navigating relationships and those bringing in more sweet moments. Thank you so much. Bye-bye.